Thank you for joining us on this really beautiful spring day, finally, to thank a true champion for women's health, Congresswoman Nita Lowey. I'm Nita Lowey. I think you all know me, President and CEO of Parenthood Hudson Peconic. Last year, we provided health care to nearly 15,000 women and men and teens in Westchester County. That's not all 4 counties. More than 3/4 of our clients have incomes at or below 200% of the federal poverty level. Without the federal funding from the Title X Family Planning Program or Medicaid, the patients who count on Planned Parenthood for care here in White Plains and around the country would not be able to access birth control, life-saving cancer screenings, and testing and treatments for sexually transmitted infections. Over the past 2 months, Planned Parenthood, one of America's most trusted and most cost-effective providers of women's preventative health care, has faced an unprecedented assault in the United States Congress. Congress banned federal funding for abortion more than 30 years ago. Yet under the guise of eliminating federal funding for abortion, House leadership, this current House leadership, attempted to dismantle Planned Parenthood. For good reason, smart policymakers and the majority of the American public rejected this purely political move. The debate over these extreme proposals held policymakers, the press, and the public helped policymakers, the press, and the public understand the vital role Planned Parenthood plays in women's lives. The debate also showed that elected officials with an extreme political agenda, like Senator Kyle, can't get away with twisting facts at their convenience. Americans see women's health as very valuable, and they didn't elect this Congress to endanger women. Among the elected officials who stood with Planned Parenthood is Congresswoman Nita Lowey. She is one of the strongest, most passionate advocates for women's health in the United States House of Representatives. Throughout these years, she has fought against every attack on reproductive rights. We know that Congresswoman Lowey can always be counted on to stand up for women, here and abroad. During her distinguished career, she has fought to increase funding for the Title X Family Planning Program, the very program that the current Congress has worked so hard to dismantle. The women and families of Westchester are so fortunate to have Congresswoman Lowey representing us in Washington. Last week, she spoke passionately on the House floor, urging her colleagues to protect Planned Parenthood and the preventative health care services we provide. We need many, many more Mrs. Loweys, not Mrs. Hayworth. Dr. Hayworth. I'm thrilled to have Congresswoman Lowey here to say a few words about what is happening in Washington. Before I turn over the mic, I want to thank you on behalf of all of our staff and our patients here at Planned Parenthood for everything you do to fight these outrageous attacks on women and their freedom. And to present you with a giant thank you, I stand with Planned Parenthood card signed by staff and patients. Thank you.
That will happen. We should take a picture.
Yeah.
But then we should take a picture with everybody.
I agree. Jessica, your light doesn't matter. Got it? I keep looking at Jessica. Okay, we got plenty. Please, Congresswoman Lowey.
Okay, first of all, I want to tell you what a delight it is to me to be here. Raina and her husband and the board and all the people who work so hard to make this place what it is. I want to personally thank you. The educators, the supporters, the rabbis. I have had personal relations, that's dangerous. So many people in this room that I just want to thank everybody because you are so important. Raina, when I think I've been in the Congress 22 years, and we've been fighting this battle for, well, even before me, for 22 years, it is extraordinary. I had a group of young people in my office just this morning, and they were talking about issues in Uganda, and then I had another group where we were talking about Pell Grants, and then I looked around at the young people and I thought about where I was going, and I said, how many of you voted in the last election? Yesterday I was at Purchase College, And I was actually talking to people who were the recipients of Pell Grant. How many of you voted in the last election? We have got to do something about this, and I know how active you are, but elections have consequences, and we have got to be sure. Say sure. We think we'll settle this once and for all. It keeps coming up again and again and again, and I cannot tell you how much I personally appreciate your efforts, because we know everything you're doing. You are working so hard to continue to improve women's health. Just a few numbers. In February, to remind you all, we passed a spending bill for 2011 with draconian cuts to a number of critical programs, including eliminating family planning and a mean-spirited prohibition on Planned Parenthood receiving government funds. No, when I looked at the 87 freshmen who were brought to Washington by the Tea Party, I thought, maybe they do these things just to get to be elected, that they really don't understand, and we'll see whether they do understand later on. But I opposed, and many of my colleagues opposed, this ill-conceived measure and authored an amendment to restore family planning services. Last week, the House passed and the President signed the spending bill for the remainder of 2011, and I'm very pleased that we were successful in protecting many of our priorities. Instead of facing elimination, Title X family planning will receive $300 million. And I'm proud that there was a bipartisan effort, because it should be bipartisan, to get this done. Not only will this help more than 5 million women and men access contraception and other services, it is fiscally responsible, because we know that every dollar invested in family planning saves nearly $4 in future Medicaid costs. We were also successful in stopping the pathetic political attack on Planned Parenthood. There is already a long-standing prohibition on the use of federal funds for abortion. I can't tell you how many times a day and night I say this: no federal funds for abortion, no federal funds for abortion. And I'm very pleased that the enacted law allows Planned Parenthood to continue to access federal funds for Pap tests, breast exams, routine gynecological exams, flu vaccinations, smoking cessation services, cholesterol screening, contraceptives, and all the other important services that it provides. Although I did not support every cut, including trimming family planning by $17 million, I did vote for the final agreement, which is the largest ever annual reduction in spending. The 2011 spending bill was the first in what will likely be numerous debates about our priorities. Look, I have said it over and over again. We need to get our fiscal house in order. There is no question. But we cannot do so by eliminating women's health. So rest assured that I will continue to do everything I can to protect preventive health services. And I acknowledge Rabbi Wiener, but I should say members of the clergy. We welcome members of all faiths and persuasions to support this. It is absolutely essential. And I want to thank all of you again for your advocacy, for your hard work. When you get out there, men and women, really speaking the truth, talking about the facts, it is reasonable However, there are too many people out there, as we know, just follows the line. And I'm hoping that we can continue to educate so we don't continue for the next 22 years have a battle royal every time this issue comes up in the Congress. So thank you so much, all of you who work here, all of you who support Planned Parenthood. We really appreciate your efforts and your activism. For me, it's a privilege to continue to work with you. Thank you.